People ask what makes the advanced muscle integration technique uniquely different. Most of the systems out there in the sports medicine world focuses on tight muscles, restricted motion. And so they work to try to increase flexibility through stretching, reflexes, fascial work. But in my view, those are all symptomatic of inhibited muscles. So when a muscle inhibits due to injury, it loses its ability to inhibit its antagonist muscle. And so as a result, the antagonist muscle stays tight through all planes of motion. An example of that would be chronically tight hamstrings. Everybody treats the hamstrings. They stretch. They use different procedures to increase the flexibility. But as most athletes know, within 24 hours, the hamstrings are tight again. In my model, the hamstrings are merely a symptom of inhibited quadriceps. So one or more of the quadriceps have become neurologically inhibited due to injuries sometime in your career. When a muscle inhibits, it loses its ability to inhibit its antagonist. So the antagonist stays tight through all planes of motion. So we take tight hamstrings that have been chronic. Simply by reactivating the quadricep muscles, the hamstrings release. And we don't have to keep stretching the hamstrings. This whole concept allows us to understand why muscles are chronically tight. They're tight because their antagonists have become neurologically inhibited due to injury. So by focusing on reactivating the inhibited muscles, the tight muscles will disappear simply because you've changed the cause rather than treated the symptom. And that's one of the key concepts of this approach.